Hello, my name is Natalie Turvey and I am Director and Principal Psychologist at Drop of Life, a psychology clinic on the Gold Coast. And I am going to do a series of videos around mental health disorders. And the reason for that is I'm trying to reduce stigma around mental health. So the first series that I'm going to do is about anxiety disorders because they're the things we see typically more often than not in our clinic. And the first one that we will do in today's series is going to be separation anxiety. Then we're going to move on to selective mutism. Then we're going to do specific phobias such as spiders or animals. And then we're going to do social anxiety. Then we're going to do panic disorders or social phobias, agoraphobia, and then substance or medical induced anxiety disorders will be the last one that I do in this series. So I will have them all placed over here on the side for you so that you're able to follow along with me. And I will also do the selection criteria from the DSM on the side here. The DSM is this massive great thing. This is an old version of it, but it's obviously a very well used book, and it stands for the Diagnostic and Statistical Manual of Mental Disorders. And this is where pretty much anything that happens in psychology will be in here somewhere, and this is where we have all our selection criteria to make a diagnosis of a mental disorder. Okay, let's get started on separation anxiety. So broadly speaking, it is the fear or the anxiety around a parent or a caregiver leaving and not returning. It's recurrent and it's persistent, and it has to meet at least 3 of these criteria here on the side. So we do start to see it occurring for at least 4 weeks or more. That has to be going for a little while. And in adults or in young men and women, we start to see it has to be going for at least 6 months or more. So we're noticing things like there is fear around the caregiver being hurt or not turning up, or that they're personally going to get kidnapped or get lost. So they start really fearing lots of different things around that, and they won't go out by themselves. They're starting to be alone. They don't like to be alone. They find it difficult to go to their room by themselves. You do start to, most parents that I see who bring their children in with concerns like this, they're starting to really notice it when they're putting their child to bed at night. They're sort of noticing that the child will not go to sleep without them lying next to them and until they're asleep. And it's not just because all my children liked to have me go to sleep with them as well, but this is a little bit more, it's a bit more excessive. The child will become quite distressed, quite inconsolable when their parent or caregiver aren't able to stay with them until they fall asleep. You will notice them not wanting to go to sleepovers, having trouble going to camps, not doing what children should do in a normal environment, in a normal situation, and getting pleasure out of those activities that are age appropriate. So you do start to see those trends coming out. Most children, the average onset of this is around 5, but we really do start to see more of it being presented at clinic around 6, because then it's starting to become obvious because of school. And we're starting to see them not wanting to go to school. They're very fearful of their parent leaving. They're very fearful of that they're not going to turn up. So they need lots of reinforcement of my mum coming back, is my dad coming back, is my caregiver coming back. And they do start to perhaps get concerns with them being kidnapped or getting lost. And we do start to see lots of physical concerns coming up as well. So the headaches, the tummy aches, the lots of stress-related physical concerns start to be very obvious. And like I mentioned, it does have to be going for more than 4 weeks, and you do start to see it impacting on the child's social life and also their schooling as well, because they can't concentrate because they're so fearful of their parent or caregiver not being okay. We do have a certain level of developmental, age appropriate loss from their child. So not loss, but when about the age of 1, we start to see children, babies, toddlers becoming really anxious when their caregiver is leaving them, and that's kind of age appropriate. But when it sort of heads up into the ages of 5, 6 and 7, and we're starting to get lots and lots of distress around parent leaving, then it's no longer age appropriate, because it's stopping them doing what they would normally do in an age appropriate situation. So we're starting to see the young children not wanting to go on camps, like I mentioned, not wanting to be away from their parent, and they're often described by their parent as very clingy, and they're like shadowing them all the time. As far as genetic factors and what brings this around, we do see that there's like a 73% genetic factor involved in this. So if the parent or caregiver was anxious as a youth, we might see that trend happening in the next generation as well. But it's also got to do with environmental factors as well. One of the clients that I've seen recently was a 6-year-old girl, and her parent was very unwell, and they were very, very unwell, and there was a lot of fear that this mother would die. And so, as you would naturally expect, the 6-year-old had lots of fear around her parent dying, but then her parent got treatment and she got better, and that fear was no longer real, but the child was still excessively worried that the parent was going to die, and she would need lots of reinforcement of ringing up, yes, I'm going to be there, lots of constant reinforcement from the parent to say that she was going to be okay and that she was going to turn up when she said she was going to turn up. So that's a little bit about just a brief touch on separation anxiety. If anyone is concerned or have any questions around that, please feel free to drop me a line or contact the clinic. And the next session that we have, the next video, will be on selective mutism. So remember today and tomorrow to be kinder to yourself than anyone else can be. Thank you very much.